Okay, now today there will be 4 new vaccines which are newly added to our national immunization schedule. Okay, first coming to the rotavirus or vaccine for rotavirus. So first I am giving a brief description regarding rotavirus. What is rota? That is, it comes in the family Reoviridae. The name rota comes from because in under electron microscope it looks like a wheel. Okay, that's why the name rota. Okay, it has 11 segment double stranded DNA which encodes for 6 structural and 6 non-structural viral proteins, and those are surface proteins. Okay, the surface proteins are 2 types. One is G protein and another is P protein. These proteins are responsible for creating neutralizing antibodies. This G protein usually produce 14 serotypes and P protein produce 14 types of serotypes. These permutation and combination of G and P, suppose G1 P1, then G2 P2 up to G1 P15 14, then again G2 P1, like this the permutation and combination going on. These are responsible for only producing infection in human intestine. Okay. A brief about the clinical manifestations. What is the incubation period? That is 1 to 3 days. The onset usually abrupt. What are the clinical features? Some babies presents with transient loose stool. Some presents with severe diarrhea associated with vomiting. First infection of rotavirus is usually most severe. Later if subsequent infections, the mortality or rate is very much low. Okay, because some kind of protection after first infection usually appear in the body. What is the mode of spreading? One is fecal-oral route and another is, which is asked very often, that is by fomite. Okay. Usually it affects mainly infants, okay, so less than 1 years of age. How it is diagnosed? That is RT-PCR on ELISA. All of you know that RT-PCR diagnosis or ELISA diagnosis takes time. During COVID, it is usually 36 hours till diagnosis. So by then the child may die. That's why the prevention part is that much important. We prevent this disease, and also there are no specific antiviral treatment, only supporting treatment, that is for diarrhea there will be loss of fluid, dehydration, so only ORS and zinc supplementation. So the mainstay of reducing mortality regarding rotavirus is prevention. So usually there are 4 types of rotavirus vaccines available in the market. One is Rotasil, second is Rotavac, third is Rotarix, and fourth is Rotatec. Okay. Rotasil actually introduced in our UIP before. It was live attenuated oral freeze dried vaccine. So it is used to be reconstituted with citrate bicarbonate buffer, and it was given in 3 doses, that is on 6th week, 10th week and 14th week. Rotavac, it is currently used. Okay. Only one virus is freeze dried and live attenuated. Sorry, live attenuated 2 types, but freeze dried and live attenuated and usually available. So the strain number of Rotavac, it is asked 1 or 2 times, and the difference between Rotasil and Rotavac, it is usually asked, okay, in Viva or in anything. Rotavirus also, what is Rotavac? It is rotavirus 116E G9P11 suspension. The dose is same as Rotasil, that is 6, 10 and 14 weeks. Both Rotavac and Rotasil are now in circulation, but Rotavac is most commonly used and available. That is the true case for our West Bengal state also. Okay. What are the other 2? That is Rotarisk live vaccine, 2 doses as 2 months and 4 months, and Rotatec, that is live. and that is live attenuated vaccine. Human bovine reassortant vaccine. It contains G1, G2, G3 and G4. Not sure about the P antigen serotype, and it is given 3 doses as 2, 4 and 6 months of age. It is available in private. What are the efficacy? All these viruses are efficacy are 40 to 60%. Coming to the first Rotavac. It is a rotavirus vaccine, is a live attenuated oral liquid vaccine and available in 10 dose vial and does not require reconstitution. Open vial policy is not applicable to Rotavac. Dose is usually 5 drops, 0.5 ml. It comes usually under liquid frozen form. In liquid form, the vaccine is generally pink in color. Supplied with a pink color dropper that is longer and wider than the dropper used for OPV. Okay, that dropper or dispenser is not correctly matched. Okay, usually it is this much length. I will show you the picture. And it is administered only with the dropper supplied by the manufacturer. Rotavirus vaccine as VVM2, which is used for the least heat stable vaccine. Any other vaccine where VVM2 is used, and it is stored along with just above BCG in the cold chain. When I will teach you the cold chain, I told you na BCG, reconstituted BCG is the least heat stable, most heat sensitive. That means least heat stable. Okay. After that OPV, then Rota actually comes. Okay. How it is administered, I already told you that 3 doses, 6, 10 and 14 weeks along with the other UIP vaccines. So, 6, 10 and 14 multiple vaccines are given. Correct na? I will ask you the name. No booster dose of rotavirus vaccine of this Rotavac is recommended. The maximum upper age limit for giving the first dose is 1 year. Mild illness such as UTI or mild diarrhea, it may appear. Okay. I have already told you regarding AEFI. You were present in the class, na? AEFI, first class. No response. Okay. So, whatever mild illness and such as UTI and diarrhea, it is expected. Okay. But it's not a contraindication for rotavirus vaccine. What is the full form of AEFI? Adverse effects, events. अगर कांड हो चुका है तब वो AEFI होगा. इफेक्ट तो स्मॉल है. हाँ, तुम वैक्सीन दे रहे हो, बिसाइड देखा मम्मी फेंट हो गई. That is effect. Okay, now see in the picture. That is, first follow the sequence. Usually it comes with that pink color cap. First cap is dispensed. In the picture 3, tear the film. In the 4th, then the seal. Okay, it is done this by step. Remember these steps because mixing this picture, it may come in INI-CET. Okay, arrange it. After that, the plain vial, it is dispensed and the dispenser is added. And how I told you regarding the OPV, how OPV is given, the same policy. Okay, the picture is confusing. Giving Rota vaccine is also same policy. Just keep just open the mouth and keep the ear on the 90-degree angle. The 5 drops. That is 2 drop. This is 5 drop. Okay, I will come to the second picture. One more question is asked. If a child comes to your immunization center on the 6 weeks, okay, which vaccine gives first, OPV or Rota? First answer is first OPV, then Rota. Is there any time gap? Usually, other vaccines are given also. Now you can understand. If you remember, in what other vaccine gives in the 6, 10 and 14 weeks? OPV, Rota, that is others, pentavalent. Okay. So, start with oral vaccine, then after wait for 5 minutes, start with OPV, then wait at least 5 to 10 minutes, then give the child second oral dose. Okay. Now coming to the next vaccine, which is now very popular in the market, that is PCV. The pneumococcal vaccine, what is the organism? Pneumococcal, what is the name? Streptococcus pneumoniae or pneumococcus. So from micro you all know that it has bimodal age group that is get affected. One is under 5 and another is elderly. Okay, that's why the adult immunization has been introduced. I told you that adult immunization is a very upcoming topic. It may come as a short note in your theory exam. Okay. So the epidemiology of pneumococcus I am not giving because you all have read it in the micro. It's a coated bacteria or non-coated? Anyone remember? Just read again. Connecting is the first part of getting good marks in INI-CET. Okay. Fight pneumonia, PCV 10/13, that's a pneumococcal vaccine. I already told you that before 2018, the main cause of neonatal mortality, infant mortality was pneumonia or respiratory problems. So after introducing PCV and one national program, I told the name in the last class. Anyone? SAANS. That's a new national program. Okay. After introducing SAANS and PCV, that this cause has been decreased. Previously, it was a pneumonia mortality rate of 7 per 1000 live births. The most common culprit being Streptococcus pneumoniae. Any other bacteria that causes pneumonia in children? Last দিনে একটা ভ্যাকসিন পড়িয়েছি। This PCV vaccination is a safe, effective and cost effective. 3 vaccines have the potential to significantly reduce the childhood mortality from and related to pneumonia, PCV, HIV, content pentavalent vaccine and measles vaccine, because measles also create sometimes respiratory distress. These lines are not that much important. So 2 types of pneumococcal vaccines are available. Okay. One is PPSV, that is polysaccharide content vaccine. That is 23 valent polysaccharide vaccine available since the early 1980s. Okay. And now the newest type that is you saw, that is PCV. কোথায় গেল? That is 10 valent and 13 valent that are now currently available. There are 2 market names usually. One is Prevenar, okay, and second is Numosil. Prevenar, only remember this point, Prevenar is not, that is made in I think in China, that is not in insidious origin, but Numosil is made in our own Bharat Biotech. And second difference, Prevenar is 4 dose vial, 5 Numosil is 5 dose. Okay, these are asked. The strain is different, but that is not asked. These 2 difference you should remember, that is Prevenar and Numosil. Okay, so first India has planned the introduction of PCV into its UIP and Indian evidence. It is introduced in the phased manner. Okay, I have added this because phasing in was important for PCV. Many states have different causes of mortality for neonates and infants. So those states who have higher neonatal mortality rate due to respiratory distress, it was introduced in those states earlier. Our West Bengal, Assam, Bihar and Madhya Pradesh was among them. Okay. The dosing schedule, 2 primary dose at 6 weeks and 14 weeks, followed by a booster dose at 9 months is recommended. A multi-dose, that line is not that much. That again remember that PCV 13 or Numosil, sorry, PCV 13 is Prevenar, that is a 4-dose vial. This is a freeze sensitive vaccine stored at +2 degree to +8 degree in the basket. Do not freeze the PCV, it is a freeze sensitive. What are the other freeze sensitive vaccines? I told one specific term that if you remember that you will correct. Regarding this, the most common, look for the bold point, the most common PCV side effects are irritability, crying, swelling and tenderness at injection site, transient fever more than 39 degree or 102 degree Fahrenheit. It is a costly vaccine, so sometimes cost also make it a open vial policy applicable to PCV 13. The permissible wastage is less than 10%. Now to the picture. At 6 weeks, first vaccine is OPV1, then gives the Rota both by oral, then gives in the right hand IPV or FIPV, then in the anteromedial of the right thigh PCV1 and then in the left thigh Penta 1. This is the sequence. The vaccine is given in 6 weeks and 10 weeks and 14 weeks. Remember the picture, because if it can be asked in the, or it can to arrange or in any type of MCQ. Okay. Now coming to the third type of vaccines, that is TD. Sorry, I do not have the vial. Okay. Why? For the rationale it is being asked sometimes in the, as a explain why question, why TD is introduced instead of TT. So the what are the rationale? Write these 3 points. Majority of the cases of diphtheria are occurring in the age group of 5 years and above, and the mostly are unvaccinated. Since 1999, there have been more than 80% reduction in tetanus mortality. However, diphtheria outbreaks are increasing, which reflect gaps in diphtheria protection. From extensive multicentric trials and studies, it is now well established that immunity to diphtheria subsides following the primary series of DTP vaccination, and that booster doses of diphtheria toxoid contained vaccines are needed for continued protection. Anyone can answer what is the maximum age of giving DPT booster or any DPT vaccination? 7 years. And the booster or second booster, what is the site? The use of TD rather than TT is recommended during pregnancy to protect against maternal and neonatal tetanus and diphtheria. During prenatal care, TD also boosts decreasing diphtheria immunity in addition to assuring tetanus protection and help to curtail diphtheria outbreaks. What are the target groups? So for TD, that is children of 10 and 16 years, school going. Why school going? স্কুলে গেলেই হচ্ছে কি কাটা ছেড়ে বেশি হবে, খেলাধুলা করবে, হ্যাঁ, সেখান থেকে দুটোই হতে পারে। করোনি ব্যাকটেরিয়া হচ্ছে গিয়ে ডিপথেরিয়া হতে পারে, আবার টিটেনাস হতো, ক্লস্ট্রিডিয়াম টিটেনিয়া হতে পারে। এই জন্যই তাদেরকে ফার্স্ট করেছে। অ্যান্ড প্রেগনেন্ট, obviously to prevent the neonatal tetanus and also diphtheria. VVM 30 is used in the TD, okay, remember that. The shelf life is 24 to 36 months. These are the new UIP schedule for 10 to 16 years, that is TD booster, and for pregnant TD1 early in the pregnancy, you always say during the at the day of registration, okay. At the day of the registration, mother is given 2 things, one is TD1 and second is NCP card. TD2 4 weeks after TD1 and TD booster if pregnancy occur within 3 years of the last pregnancy and two TD doses were received, then the booster is given. If an unvaccinated mother comes to the unvaccinated, pregnant women come to the OPD or your hospital, what to do? Read in the book. That is your homework. Okay. The storage, packet size, presentation, route of administration, wastage rate, doses are required. TT vaccine can be given as a subsequent dose following TT. This is asked in the PGI. Okay. Can we give TT following TT? The answer is yes. And all previous TT doses will remain valid. There is no need to restart the syringe. Now coming to the next and last vaccine of the day, that is JE. The level will be blurred. Okay, so what vaccine? Actually the question will be, after giving this, what type of vaccine is this should be? There will be multiple options and you have to tell the every one of them. It can be OPV, it can be any other. Usually the question usually comes in your table like this. What vaccines it? Now coming to the JE, Japanese encephalitis, it's a mosquito-borne zoonotic viral disease involving the animals and humans. This question is asked, horses are the primary affected domestic animal of JE and essentially a dead-end host. Other equids means the horse-like creatures, equines, are also susceptible. Remember one thing, for JE, human is also one dead-end host. One human cannot spread JE, okay, to another human. We are the dead host. Any other parasite you remember, that is a dead-end host. Human is the dead-end host. RD? Another? কুকুরদের খুব হয়, নাম প্যারাসাইটটার নাম কুকুরের নামে, আমরা ওদের ডেড এন্ড হোস্ট। লিভারে হচ্ছে গিয়ে থাকে, খুব সুন্দর বলের মতো দেখতে হয়। অ্যাকচুয়ালি যদি কখনো ওটিতে যাও, আমি একটা কেস পেয়েছিলাম, ইকাইনোকক্কাস, খুব সুন্দর দেখতে হয়, একদম বলের মতো। ঠিক লিভারের হচ্ছে ইনফিরিয়ার সারফেসে থাকবে, তুলবে আর দেখবে বাসা কোথায় আছে, এবং গোটা বলটা স্ট্রাকচার সহই তুলতে হয়। যদি ফাটিয়ে ফেলো সঙ্গে সঙ্গে গোটা বডি রিয়াকশন শুরু হবে। হাইলি অ্যানাফাইল্যাকটিক সাবস্টেন্স থাকে ওর মধ্যে। The virus is maintained in a transmission cycle between mosquito vectors and vertebrate hosts. In nature, the virus is maintained in the RD'd birds and other animals, particularly pigs. I think JE epidemiology আমাদের থিওরি ক্লাসে কি পড়ানো হয়েছে? মনে রাখবে যে পিগ হচ্ছে the amplifiers. So pigs actually important amplifiers of the virus, producing high viremias which infect mosquito vectors. JE transmission cycle, believe it or not, it came once in the FMC. Okay. The multiple ends were missing and arrows were distorted. You have to arrange. In the exam, this is correct picture, sorry, same picture. Why it is named Japanese? Because the first historic mention of JE occurred during the late 1870s in the Japan, where it was first named summer encephalitis. Again in 1924, the disease hit Japan and it caused 6,125 human cases, resulting in 3,797 deaths, 62% case fatality. Okay, every 1 person among 50% এর উপর হচ্ছে গিয়ে মারা যাবে। The virus was first isolated also in Japan in 1935 from a fatal human case. In 1938, the virus was first isolated from its primary vector species, Culex trieniorhynchus. I have read an article where it was said that rabies হচ্ছে confirm in dog কিভাবে করে জানো? আগে করতো, এখন that was very inhuman. কোনো কুকুরটা সত্যি র্যাবিড ডগ কিনা, নেগরি বডি, কোথায় দেখতো? ব্রেনসে দেখতো। তাহলে তার জন্য কি করতো? যে কুকুরটা হচ্ছে গিয়ে সাসপেক্টেড তার মাথাটা কেটে নিয়ে জমা দিতে হতো। ওকে, ফর দিস এনসেফালাইটিস হিউম্যান হেড ওয়েট 7 সাসপেক্টেড কেস। খুবই বাজে লাগছে, বাট দ্যাট ওয়াজ দ্য ট্রু। These all things happens before introduction of bioethics. So for prevention, 4 types of vaccines are available to use against JE. One is mouse brain derived killed vaccine. Second is cell culture based killed vaccine. Third is live attenuated. And fourth is live chimeric vaccine. This is the one mouse brain derived killed vaccine that is usually used Nakayama or Beijing strain. It was first introduced and was widely used in the past. There was a primary dose and followed by boosters in 6 months. It was expensive and it was ideal for travelers who were actually visiting the JE affected area. Has severe adverse effects. It was banned from 2007 in India, in many other countries. Just remember the Nakayama strain. Okay, it is asked that what are the Nakayama strain used in what kind of vaccine, that is mouse brain derived killed vaccine. The name also you remember, that is JIV. Usually question comes like that, JIV used Nakayama, Genvac used this strain, Jivex this strain. You may expect as a that match and following, match the things. It was given subcutaneously and multiple dose. Okay. Live attenuated vaccine, GVAX. It is also called SA-14-14-2 vaccine. It is presently used in the India. 2 doses of 0.5 ml subcutaneously, safer up to 15 years of age, not recommended for adults, and it is highly effective for use against mass campaigns. This is the current GVAX. It is currently used in the EYP. Okay. One more bit of information. First cases of JE in India actually found in West Bengal, your neighbor district Bardhaman and Bankura. Okay, and remember Birbhum also JE endemic district. So JE vaccine is given here. Okay, if you went to family or were going in future, ask about the JE vaccination. And Genvac, it is the purified inactivated vaccine, Verocell derived purified. It is indigenous and using the strain obtained from Kolar, Karnataka. Kolar strain usually comes with a also number, Kolar something. Okay, just check the net or I will give you later in the PPT. There are also 2 doses intramuscularly, 28 days apart for routine immunization, and single dose of 0.5 ml during epidemics. 98% seroconversion after 2 doses. It is launched officially in October 2013, available in market but not yet introduced to routine immunization schedule. And remember, for adult dose, Genvac is used. Okay, Kolar strain is for adult immunization of JE, and SA-14-14-2 is introduced in the routine immunization. What is the name of the brand? That is GVAX. I think that he also has some name. What's the name? Is it written in the JE? I gave you the vial, na? Ki name lekha ache?